Welcome to South Africa, a country home to 48 million people, beautiful beaches, and extraordinary wildlife, and the most people infected with HIV/AIDS than any other country in the world. In South Africa, 5.7 million people are currently living with HIV. That means that 1 in 5 adults is infected. In sub-Saharan Africa, women represent 60% of the infected and 77% of newly infected from ages 15 to 24. These numbers are not entirely accurate. Due to antenatal testing, women are tested more frequently and therefore are seen as spreaders of HIV. AIDS has slowly become a woman's disease.
My name is Nomonde. I am 40 years old. I am married. I've got 3 children. I'm working at Bido Plant Aid Foundation as a community home-based care to helping sick people in the house.
Ndike ndaqalisa for ngingu-43 ndandine-TB ndayitya treatment ye-TB ndayigqiba and then ndaku-ARVs.
What we're finding, to be able to increase our patients on treatment by 300%, we need to have more people tested. And how do you get more people tested? Because it's usually the woman, and it's usually the pregnant woman. It's usually during the pregnancy workup that people test, and it's by testing people who come in with opportunistic infections.
The social status of women in South Africa creates many roadblocks when trying to fight the AIDS pandemic. 1 in 5 girls under the age of 15 has admitted to being sexually harassed or abused, and over 55,000 cases of rape were reported in 2008. Lack of economic opportunities often lead women into selling their bodies for money because they have no other way to support their family or themselves.
And when they are not getting some jobs, they do unnecessary things with their bodies and came back when they are sick, and they don't even disclose to their family about their status.
Because testing is actually, it's been shown, it's an incredibly strong preventative measure. Condoms, great if everybody used them, but in terms of, just as I was saying before, just that moment of testing is an eye-opener where your life flashes before your eyes, and if it's negative, then you want it to be negative next time.
Some of the people, they are very sick, and some of them, they were not accept the sickness they've got. I think we must go to the schools to teach them that if she's got someone that she fall in love with him, they must both go to the clinic and get tested, or they must abstain.
Young married women are at the greatest risk because they cannot ask their husbands to test for HIV or use protection in fear of showing a lack of trust. Yet women do have the power over how to raise their children. 25 to 30% of the time, mothers pass HIV onto their babies whilst giving birth or through breastfeeding. Mothers are the most powerful educators of their children, and it is important that they raise their kids to be aware and open about AIDS.
I did empower her that she must look for her a job. We've got power that we can work to raise our children.
Well, basically, a woman doesn't need her husband's permission to test. So she goes into the clinic and she tests. The problem is getting the husband to test.
I tested and found that they are HIV positive, and tell them how they can raise their children. So not to mix feed the bottle, they must use what the sisters told them. They must take their medication properly and listen what the doctors told them.
Because the clinic is a very hostile environment, particularly to young people, And then we've got unfortunately, our highest peak incidence was 25 to 29-year-old females, peak incidence of infection. But we've noticed that the 15 to 19-year-old, whereas that's sort of leveling out, the 25 to 29, that's really climbing. So we're looking at the youth now, and the infectivity is rising amongst the youth, and it's hard to access those people. And it doesn't work in the clinic environment. No teenager wants to go to the clinic.
Empowering the women that they must stand, they mustn't to be so shy to everything, even if they've got the problem in their houses, so help them to come and sit and talk about their problems.
We've tried to have support groups over and over again, and patients just don't like it. So we've kind of come to realize that you can't spoon feed people, you can't run after them. If they make a decision that they want this treatment, then it's up to them. You know, they must go out there and take their treatment, and we'll monitor them clinically. But we can't have 3 caregivers for every one patient trying to spoon feed them to keep them on treatment, you know. 5.
As catastrophic as the AIDS statistics may and rightly seem, progress is being made regarding the distribution of medicine and creation of clinics in South Africa. In communities, openness and discussion regarding AIDS is slowly increasing as more and more people come out of hiding and reveal their status to their neighbors. Community leaders and teachers are encouraging more people to step forward, get tested, and begin treatment.
To me, we need to take testing and we need to take treatment out of the clinic environment more into a social situation.
We go and help them to empower them that they must go to test at clinics. There are at clinics, the city councillors, they are going to help him.
But the men are coming forward. I'd say about 25-30% of our patients now are the men. And there's a big move in South Africa to try and encourage that section of the community to become more involved in testing and getting onto treatment, and just changing the cultural mindset. It's called Brothers for Life.
It's difficult because everyone's got the right to do what he wants, but we'll keep on talking to him and show the right things, that if he go and test, he will get the medication that can help him.
So the plan now is to actually move those stable patients out from the central clinic, so they don't have to come there every month, back into normal chronic care in the outside clinics. And then the shift will go far more towards the caregivers and the adherence counsellors and the home-based carers.
I want maybe sometime I can go to Eastern Cape and help those people and empower even the people that they must talk about themselves and they must be bold and becoming helpful to the others.
Due to governmental failures and falsehoods told, AIDS treatment and prevention is late to come about in South Africa. The government can only provide resources such as medication, infrastructure, and clinical help. It is up to communities to take a stand and choose to make AIDS an acceptable, talked about disease. True prevention and progress will not occur until people become accountable for their own actions and feel they have something to protect, their negative status. Women's empowerment is crucial because in order for HIV/AIDS to steer away from the stigma of a woman's disease, women must empower themselves socially and economically.